A 31-year female came for obstetric ultrasound. She is worried about growth of fetus as she had already done ultrasound and they told her that the growth of fetus is compromised. Now we start scanning. First we will place transverse probe at suprapubic area and here we see the bladder. The bladder is full. For second and third trimester, full bladder is not recommended or not required. But if we see the bladder, the walls of bladders are thickened and echogenic. And here we also see a debris in the base of bladder. It means patient is suffering from urinary tract infection. On asking from patient is also complaining of painful micturition and urgency. Urinary tract infection could be harmful for fetus and can cause any pathology or abnormality in the fetus. So patient should advise to treat UTI. Now we will measure the size of wall of urinary bladder. The thickness of urinary bladder wall is 9.3 millimeter, but normal size is 5 millimeter with full bladder. Adjacent to urinary bladder, we see the uterus and head of fetus. It means the fetus is lying cephalic position. If we see the legs of fetus here, then it will be breech presentation. Now we see the cranium of fetus, which is normal. For fetal head measurement, need biparietal diameter. For exact position of biparietal diameter, we will see the thalami and there is third ventricle and hippocampus and there will be a arrow sign. Now in dual mode we will save the image of head and then we will scan the fetus. Now we will rotate the probe in longitudinal view. Here we see the eyeball of fetus, which is hypoechoic. Here we see the neck of fetus and then heart of fetus and cardiac activity. Here is liver This is urinary bladder. And here we see the pelvic bone. Now we will move the probe right and left of the abdomen to locate the femur bone. Here we see the femur and slightly rotating the probe to get the maximum size of femur. Now we will measure the size of femur. And now biparietal diameter. For that we will take measurement from outer end of biparietal bone and crossing the thalami, and second measurements from inner side of parietal bone crossing through the thalami. Now we will take the head circumference of fetus. For that we will take the size of cranial bone. Here we see the measurements and gestational age of head and femur. For abdomen circumference, need cross-section view of abdomen at the site of stomach, and heart and kidneys should be excluded. For abdomen circumference, vertebra, stomach and aorta could be visualized in the slides. Now we will measure the abdomen circumference and we'll take a cross-section view of abdomen. First we will set the cross-section from one side, and then we adjust the second cross-section to the other side. We will take the maximum size of the abdomen. Here we see the all measurements of abdomen. There will be difference in the days of all body parts, but it could be within 2 weeks or better in 1 week. If the difference in the weeks of body parts of fetus more than 2 weeks, then it will be a growth retardation. It means the growth of fetus is affected. Here we see the placenta, which appears to be normal. No cystic or mass seen in the placenta, and it is located at fundal area. Here we see a hypoechoic line around the placenta, which is myometrium. If the placenta is penetrated in the myometrium, then it will be also a abnormality. So we carefully see the outlining of placental layers which are attached to the myometrium. Here we see the urinary bladder and the pelvic bone. And for gender identification, first we will locate the both thighs of fetus. Here we see the first thigh and this is second thigh or leg. And now we will focus between these thigh. Here we see the gender. This is male gender. Here we see the penis and scrotum. Here we see the liquor or fluid around the fetus. Now slightly sliding the probe, we see clearly the male gender. Behind the scrotum, we see the anus. Now here we see the cardiac activity, and we will measure the heart rate by M mode. Here we see the zigzag pattern of heartbeat. Now we will measure the heart rate. The heart rate of fetus is 141 beat per minute. In Third trimester, it will be less than 150 beat per minute and more than 130 beat per minute. It will be normal. Here we see the vertebra of fetus. If there will be a missing vertebra, then it will be a spina bifida, or if there will be a cystic area in the spinal, then it could be a meningocele. Here we see the lungs and heart, and this is liver. Here is umbilical cord. It consists of two arteries and one vein. Here is umbilical vein, and the anterior is arteries. Now we will measure the ST ratio of umbilical arteries. The ST ratio or systolic diastolic ratio could be less than 4 after 30 weeks. If it is more than 4 after 30 weeks, it means there is resistance in the blood flow and it will affect the fetal growth, or fetal growth will be compromised. Now we will take the peak systolic and diastolic flow. This edge is peak systolic flow and at the base of line is diastolic flow, and we will measure from peak systolic to diastolic. Here we see the ST ratio is 3.6, which is normal. Now we will scan the cervix and we'll see it is closed or open or competent. The normal cervical length is between 2.5 centimeter to 4 centimeter. For cervical length measurement, the bladder of patient should be partially filled as cervix lies posterior to the urinary bladder. Now we will measure the length of cervix. The length of cervix is 36 millimeter or 3.6 millimeter, which is normal. Now how we will write report. Fetal lies cephalic, liquor is adequate, cardiac activity is present, and heart rate is 141 beats per minute, which is normal. Placenta is fundal. SD ratio is 3.6. Femur length is 59.8 millimeter. Biparietal diameter is 75.7 millimeter. Head circumference is 274 millimeter. Abdomen circumference is 257 millimeter. According to these measurements, the gestational age is 30 weeks 2 days and expected date of delivery is 2024 and fetal weight is 1575 gram, which is normal. Now all these parameters shows normal growth, so patient is guided not to worry about the fetal growth.